right, in the previous video we were going over the bones of the arm and pectoral girdle. This video will be the last one where we look at the rest of the bones, specifically of the pelvic girdle and the legs, and then the next set of videos will be going over joint structures and also terminology. All right, so the pelvic girdle has two major bones that are anchoring the leg onto the body, and that's the os coxae and the sacrum. So it's technically three bones, two os coxae and the sacrum. And this is a spot where it can be a little confusing because the sacrum is considered part of the axial skeleton because it's an extension of the vertebrae, but it's also considered part of the appendicular skeleton because it's part of the pectoral girdle. Okay? All right, so let's look at the os coxa. Okay? So let me actually grab the bones really quickly. I'm going to just step over here, and then I'll be right back. All right, so if we're over here, this is an os coxa, okay? And you've got two of them, and they're oriented just like this. So when you feel your hip, you are feeling the iliac crust, or the ilium of your os coxa. When you are sitting up straight, you are sitting right there. The front of your pelvis, your pubis, is right there, okay? When you put the pelvic girdle together, it looks like that. So you have a right os coxa and a left os coxa. Okay? Now, when this develops in the baby, all right, it is literally three bones, and there's a thick wedge of hyaline cartilage that forms a growth plate that goes through the acetabulum in three spots. And because of the bizarre structure of this bone that defies definition, people decided to name the different parts different things. So this top part where I've got this blade is called the ilium. The bottom part right here where my hand is touching is the ischium. And right there where my hand is covering, that is the pubis. Okay? And then they each have different features on them that are related to either articulations or muscle attachments or the movement of other things. All right? So this feature right here, right there, is your iliac crest. And then you've got your anterior superior iliac spine and your anterior inferior iliac spine. So right there, when you're looking at Sports Illustrated and you see the ladies in bikinis and they got that big bony thing sticking out because they haven't eaten enough, that's your anterior superior iliac spine. And then the inferior one is right there. And these are important muscle attachment sites. Okay? Coming back here, I have a big notch right here, and this is called the greater sciatic notch. And this is where your sciatic nerve comes out of your sacral plexus and basically goes down the back of your leg. And we'll look more at that when we do the skeletal system. The muscular system. Okay? Then you see this big hole right here. This is where you create the femoral joint. And so this is my femur bone, and that goes into the socket right there, and that's how your leg attaches to the pelvic girdle. So that socket is called the acetabulum, okay? And then this is some raming, which we're not going to worry about, but right here, this rough spot, if you're sitting up straight, wiggle around, and you will be pressing on this roughened spot, and that's called the ischial tuberosity. And this ischial tuberosity is created by your hamstring muscles. Have you ever noticed that, like, if you're sitting down for a really long time, like in a car ride, and your hamstrings get really tight, and then your butt starts to hurt? And everybody's like, oh, you need to go stretch your hamstrings. And you're like, well, why do I need to stretch my hamstrings if my butt hurts? And that's because the hamstrings attach there. And when they get tight, they pull on your butt bone. Okay? So if you stretch them out, then it feels better. Okay? Now if I come forward here, this is the obturator foramen. And then right here, this is where the two os coxae come together in the front. And this forms the pubic symphysis. And we refer to this surface as the pubic symphysis, and we refer to that joint as the pubic symphysis, okay? Now, looking here, you see where the sacrum is right there? And it's attaching to the ilium right there and right there. So this is that joint where you're creating the sacroiliac joint or the SI joint. That surface just on the ilium we call the auricular surface, okay? All right, let me move over and let's flip over to the next slide and see what we have to look at. all right? So this picture is just showing you the pelvic girdle, and you can see a little bit better here your SI joint, okay? And then right here is that pubic symphysis, okay? All right, I really like x-rays because you can really look at the different bony features. So right here would be my ilium, which I'm going to abbreviate IL. Right here is the ischium, and then this would be the ischial tuberosity. Here are the two sides of my pubis, and look at that wonderfully huge gap. That, guess what it's filled with, all right? On the inside, I have a pad of hyaline cartilage, okay? And then surrounding that whole thing is going to be fibrocartilage, which I'm just going to abbreviate fibro-C, okay? There is my acetabulum, all right? Anterior superior iliac spine, and then here is that iliac crest of the ilium. Right there, gap, notice that. That is where your SI joint is, and then of course you can see the sacrum right across there. All right, let's see what's next. All right, everybody wants to know how to sex a skeleton, right? You find a dead body in the woods, all the flesh is gone. Is it a boy or is it a girl? Well, if it's a boy or a girl, you're not going to be able to tell without genetic testing. Because the skeletons of boys and girls are basically the same. Now, if they've gone through puberty and they've gone through enough of puberty, you can sex them based on the shape of the skull, which we've already looked at, and the shape of the pelvis. The pelvis is the best indicator of biological sex, although it can trick you and you can misidentify people. So I'm going to come over here, and I'm actually going to flip to the next slide, and I'm going to show you my favorite features for sexing the skeleton. All right, so I have on either side two different pelvises. All right, the one on the right is female, the one on the left is male. Okay, now what I want you to look at is right here, the subpubic angle right there. See, this is wide. I think of the St. Louis arch, big, wide arch, all right, for a nice big outlet. On the male, look at the difference. I think of a triangle or a pyramid, very sharp and narrow, so that's male, okay? Another feature that I really like is the greater sciatic notch. If I put my thumb in there, there's not a lot of room, okay? That's male. If I look at the female right here, notice there is a lot of room. That's another favorite feature of mine, okay? There are a number of other features that you can look at as well, like the width of the ala of the sacrum compared to the body. We have what's called a ventral arc, which is actually kind of difficult to use. But this angle right here is probably the easiest for a noob to sex the pelvis, okay? All right, so let's look at some of the other slides that we've got going on. All right, so I pointed those out already. All right, so let's go ahead and look at your femur. All right, so I'm going to come over here to your femur. All right, so pretty easy to side because you can see the head goes to the top. And then you see these two bumps in the back. I think of those as the butt, so they go in the back, okay? And right there, so that's a right femur, okay? This is the femoral head, femoral neck, okay? Now right there, there's a little pit called the fovea capitis. This is relevant because you have a blood vessel that goes into that femoral head and provides blood to this area, whereas all the rest of the femur gets its blood from a completely different source, which means if you have a fracture or a dislocation right here that causes this to come out of the socket and you tear that blood vessel going to the fovea capitis, then you lose blood supply to the femoral head. Now, even if they get the joint back in, if you have done that, that femoral head, the bone is a living tissue. Without blood, without oxygen, it dies. That dies. Now, a week later, you get to have hip replacement surgery, which is a very fun process where they cut this off and they take a metal ball with a big spike about that long and they jam it down the medullary cavity. And we have a very nice example of a old-fashioned hip ball and spike that you can look at in the lab, okay? So right here, see that big bump? Now on the humerus, we had talked about the greater tubercle. This is much, much bigger, so it is called a trochanter. So do not get greater tubercle and greater trochanter mixed up. Greater tubercle. And you can feel it right there. If you push, you've got a tender spot. This trochanter is created by a number of muscles, but most importantly, gluteus minimus and medius, which lift your hip up when you walk. Now on the back, so this is the front or anterior of the humerus. This is the posterior of the humerus. I have a lesser trochanter. And if you dig in right down here at the bottom of your thigh, you will feel sort of the lesser trochanter. And this is created by some muscles, but the one that I like to remember is the iliopsoas, okay? Now if I come down a little bit further, my gluteus maximus also attaches to the femur, but not so much up here. Instead, it's right there. And so it creates what is called the gluteal tuberosity, which is a roughened area to ridge, depending on how muscular someone is, right in there. And then it contends down, and I've got this sharp line, and I think of old-fashioned pantyhose that had the black line going down the back of the leg. That is called the linea aspera, and again, that's created by muscle attachments, okay, and that goes all the way down to the back. And then that brings us down to the base of your femur. These are the articular ends, and they are called condyles. So again, as I mentioned with the humerus, a condyle is where you've got a movable joint attaching, okay? So this is medial, so let's put this on the right side. This is medial, this is lateral. So this is my medial condyle and my lateral condyle, and I want you to practice that every time. Don't just say condyle. Medial condyle, lateral condyle. That is the patellar surface. And then right here, like with the humerus, I have a medial epicondyle and a lateral epicondyle. So that's lateral, that's medial, okay? Now I'm going to grab my tibia, and don't move, I'm just going to move the slide forward so you can see the spellings. All right, so here's my tibia. Now what you want to remember with your tibia is that it is medial, always. It's always on the inside of your leg, okay? And then the tibia comes down, and it has condyles just like the femur does. So let's actually put this on the right so that you're sighting it correctly. All right, medial condyle of the femur, medial condyle of the tibia, lateral condyle of the femur, lateral condyle of the tibia. They go together, okay? Now I don't have a patella out, so I'm just going to show you on this really quickly. This is where my quadriceps tendon is. That's the patella, and then you can call this the patellar tendon or the quadriceps or the patellar ligament or any of those. All right, now if I pull this open, there you see the patella. All right, this is a sesamoid bone, and you remember that sesamoid bones change the angle of a muscle contraction or a muscle attachment. And that goes right here. So that's the patellar surface of my femur, and it basically moves right in there, okay? And then this all comes down and attaches right there onto what we call the tibial tuberosity. So if I grab my tibia again, that's my tibial tuberosity. Now come over here, and on your tibia, feel your tibial tuberosity. When you walk around on your knees on the floor, you're pressing on that, and it kind of hurts, and that's why people wear knee pads, okay? You're pressing on that tibial tuberosity, okay? I also have what are called intercondylar eminences, which are created by my ACL and PCL, which anterior cruciate and posterior cruciate ligaments, which we'll talk more about when we get to joints, okay? Now coming forward, I have this sharp ridge, and I want you to feel that sharp ridge on your shin, okay? This is called the anterior crust, okay? And that is created by muscles pulling on the bone. So more muscular legs, you get a sharper crust. Coming down here, all right, now this is a really important feature called the medial malleolus. Now I'm going to lift my ankle up, all right, my tibia is right here. So this is my tibia, tibial tuberosity, right here, anterior crust, that is my medial malleolus. So when I hold my ankle, I'm holding the medial malleolus of my tibia and the lateral malleolus of my fibula. I'm not holding on to my tarsal bones, okay? Now, the fibula is right here, and what you need to know about that is that's the fibula. All right, and then you find the rounded end and the flat end. The flat end is the lateral malleolus. The round end is the proximal end, okay? And that basically goes just like that, okay? And so that lateral malleolus is the other part of your ankle on the outside, okay? Now these attach to the talus and the calcaneus of the foot. And then you see the medial malleolus and the lateral malleolus. Let me flip slides so that we can look at the foot bones. All right, so I've already talked about previously that these are called tarsals and that you have 7 of them, and that these are your metatarsals, and they're numbered 1, 2, 3, 4, 5 from the hallux over. And then you've got your phalanges where you have a proximal phalanx, middle phalanx, and distal phalanx, except for the hallux, which only has a proximal phalanx and a distal phalanx. Okay? Now we're going to get into the names of the tarsals. Now, if you remember, when we were looking at the hand, you had to learn the names of and be able to identify 2 of the carpals. That was the scaphoid and the trapezium. Same deal on the foot. I'm not asking you to memorize the names of all the tarsals. I am asking you to memorize talus, which is right here, because that is what goes with the tibius. The tibia goes with the talus, tibia talus. And then the calcaneus, which is this big bone right here, that's your heel bone, okay? This is where your Achilles tendon attaches. When people have problems with plantar fasciitis or heel spurs, it's often right here, okay? So this is your heel. So those are the 2 bones of the tarsals that I want you to actually know the names of and be able to identify. And that is the end of those bones. So we are done with looking at the bones of the appendicular skeleton, and the next unit is going to focus on joints.